Now let's talk about anatomical orientation. We are going to discuss the head, particularly the vertex, forehead, supraorbital region. Let's start with the vertex at due 20. This is located at the junction of the cranial midline and an imaginary line connecting the apices of the ears. This point is at a distance of 5 cun from the anterior hairline and 7 cun from the posterior hairline, marking the highest point of the cranium or vertex. When locating due 20, the patient's head should be in an upright position. Okay, let's now use the spreading hands technique after Koenig and Vankura. Chapter 2. Place the hands on the lateral aspects of the patient's head with the little fingers touching the apices of the ears. The thumbs are then joined at the cranial midline and will be pointing to due 20. So here is the illustration of the location of the due 20 and how to locate it easily. Now let's talk about the anterior hairline. The anterior hairline forms the superior border of the forehead and can vary considerably from person to person. The original line of hair growth is generally considered as the anterior hairline. In men, especially, the hairline may begin to recede early in life due to progressive baldness, so that the existing hairline may not be identical with the original line, which will now be located in an area not covered by hair. In these cases, ask the patient to frown. The original hairline will be located superior to the wrinkled forehead at the junction of the still slightly creased skin with the completely smooth skin. Points in this area are due 20 to due 24, bladder 3 to bladder 7, gallbladder 4 to gallbladder 7, gallbladder 13 to gallbladder 15, stomach 8. So here is the figure emphasizing the forehead and the points located on the anterior hairline. Temporalis muscle and temporal corner of the forehead. By asking the patient to firmly clench and release his teeth, the temporalis muscle can be palpated on the lateral aspect of the forehead. The corner between the forehead and the temples is marked by the junction of the anterior hairline with the temporal hairline, which tends to become more pronounced with a receding hairline. Stomach 8 is located in the center of this area at the insertion point of the temporalis muscle and 0.5 cun within the natural hairline. Often, the coronal suture can be palpated here. Okay, so here are the figures emphasizing the location of stomach 8. Okay, another very simple illustration of stomach 8. Now let's go to forehead. The more or less prominent bulge of the frontal eminences can be palpated on both sides of the forehead. Gallbladder 14 is located at their lower border in a shallow depression at the junction of the eminences and the superciliary arches. With the patient looking straight ahead, GB14 is located directly above the pupil, approximately 1 cun superior to the supraorbital margin. Okay, so here is the figure illustrating the location of gallbladder 14. Glabella, superciliary arches. The glabella is the central bony reference point on the forehead, forming a slightly convex level area superior to the root of the nose and between the superciliary arches. The extra point in tongue, extra head neck 3, is located at the center of the glabella. Several points are located along the superciliary arches from medial to lateral, subbladder 2, Yuyao, the extra head neck 4, and triple boner 23. Please note, bladder 2 is located superior to the inner canthus of the eye in the area of the frontal, not the supraorbital incisure when this is present.